focus today is going to be on women's health. It gives me great honor to introduce her. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, how old you are, and share your story with us today.
Thank you for having me. My name is Celina Nadelman, and I am a pathologist with a subspecialty in cytopathology. I'm based in Beverly Hills and the Los Angeles area, and I am still 52, about to be 53 years old, and born and raised in Los Angeles. That's me.
Fantastic. So where does your story begin? How did you become a health professional? What makes your business unique?
So I'd say I've always been interested in people's stories, and I thought that I would go into psychology. I was really interested in psychology as young as elementary school, and my college counselor in high school recommended that I go to a university that specifically targets, people who are interested in psychology. So I went to school on the East Coast and majored in psychology. And it was there that I realized that I had a deeper interest in science, and I kind of concentrated in neuroscience. So I was a double major in psychology with a minor in biology and a major in studio art. And after graduating from undergraduate college, I went on to live in Italy for a couple of years, and I did neuroscience research at the University of Rome, as well as attend an Academy of Decorative and Restorative Arts, because I was kind of figuring out whether I wanted to go into the arts or whether I wanted to go into the sciences. And then realized that I really wanted to help people on a deeper level. Something happened to me between my graduation from university and afterwards. A friend of mine got deathly ill, and it was we were traveling in Italy, and it was during that time that I realized that I really wanted to go into the medical field. So after I did my internship in Italy, I actually did some of my pre-med requirements and applied for medical school. And then I went to medical school, and I originally thought I would go into internal medicine, which is basic adult medicine, and did an internship in internal medicine. But it was not the right fit for me. I'm much more of a visual person. So I had always liked pathology. It was taught very well in my medical school at USC, which is now called USC Keck School of Medicine in Los Angeles. And the entire second year was taught by the pathologists. So they were very nice, and we learned a great deal from them. But when I was going to medical school, there was a big push for primary care. So it didn't even dawn on me to go into a subspecialty field such as pathology. But after I had done a year of internal medicine, I did some research at USC, Keck School of Medicine, in wound healing, basic science research. And then I fell into pathology. A friend of my mother's, who was a world-renowned pathologist, said, "Why don't you try pathology?" It just didn't occur to me to actually choose it as a field. So the first year that I did pathology, I just took my time and I just absorbed everything. And it was the right fit for me. Pathology is a very visual field. So my artistic background kind of lent itself to practicing anatomic pathology. And during my first year, we did what's called fine needle aspiration biopsies, which is when we went to the clinic and actually did biopsies on patients in the ear, nose, and throat clinic. And I thought to myself, I really like this patient interaction, because most pathologists don't actually see live patients. They see usually parts of patients, or they see, as most people know, pathologists do forensic medicine, they do autopsies. on people, but I like the interaction with patients as well as doing procedures, as well as actually finding out what they had. So afterwards, in my second year, doctor came to my residency and spoke about having a standalone FNA clinic, which stands for fine needle aspiration. And he's one of the few people in the entire United States who has a private practice clinic. And I thought, that is what I want to do. So that's what I did. I finished my pathology residency and I did a fellowship in cytopathology. And I specialize in fine needle aspiration biopsies. And what makes me unique is that I'm not only a pathologist, I'm not only the laboratory, but I'm also like the internist and the surgeon. I am all one person rolled into one. It's a one-stop shop. Most of
So
the
you
time,
are multifaceted by the sound of it. And you also have a unique delivery system. When people are waiting for these results, a lot of times it causes a lot of anxiety. So what really makes your practice unique?
well, what makes my practice unique is that oftentimes when patients need to have a biopsy, let's say, for instance, a lot of patients I see have thyroid nodules. So they have a lump on their thyroid and they see their doctor and then they go see an endocrinologist and then they go see an ultrasound tech and then the radiologist interprets what they've seen on ultrasound and they say this nodule needs to be biopsied and either the patient has to go back either to the endocrinologist or to the radiologist. They do the biopsy and then they send the material to the laboratory to a person like me. We process it and then we read the slides and make the diagnosis. So that takes a couple of steps. It takes a couple of appointments and then it takes a longer time period to actually get the diagnosis from the time that the patient discovers they have a lump to the time that they see their doctor and get the diagnosis. So with me, it's all under one roof. The patient comes to me. I do a small history and physical. I look under ultrasound, pinpoint where I need to go, prepare everything, do the biopsy under ultrasound guidance, and then I'm able to, at the bedside, see what I have, make sure I have enough to make it diagnostic, because oftentimes what happens is the operator, like a radiologist or an ENT or an endocrinologist, they're not pathologists, so they don't look at it. They just send it off to the lab, and sometimes they get enough material, and sometimes they don't. So then the patient has to come back for a repeat biopsy. With me, I hardly ever get non-diagnostics because I actually look immediately at the material, and sometimes I can even tell the patient right then and there what they have. I see it, I say, I think it's really, 99% benign. I have to look at the rest of the material. And that actually gives patients peace of mind almost immediately.
Wow. That's an amazing difference. I know the anxiety and stress that comes in waiting for these kind of results when you're not feeling well.
Yes.
Now, who are the role models in your life that helped you to get to this point?
Well, my immediate role models were, Dr. David Liu, who had this FNA clinic, and he came to my residency program and said, I have a standalone private practice FNA clinic. He was extremely kind and generous. He taught me a lot. He was very open and forthcoming. I sought him out and went to him and studied under him, and he was very open. And then, Dr. Richard Horowitz, who was my mentor, who turned me on to pathology, he was always there throughout all of my different struggles. And I miss him. He has since passed away. Of course, I've had several role models through my life. My parents have always been very open and encouraging. My father was always very creative entrepreneur and very successful businessman with a very unique business. And my mom is a very creative and creative thinking person, always doing something artistic or crafting something. So my parents, as well as these other, I guess, typical role models, have helped me shape my professional career.
That's absolutely wonderful. Now, if there was a young woman who is listening to this interview, is thinking about going into medicine, isn't sure whether she should or not, what three nuggets of wisdom would you give her?
Um, it's so funny. When I went to medical school, the number one thing I should say is nothing is written in stone. I always thought, my friends who had gone directly from undergraduate to medical school, it seemed that some of them knew that they wanted to become doctors since they were in like 5 or even like 10. And I didn't discover it until much later. And I want to say that you can always change your mind. It's happened over and over again. I decided to do one thing and took time and then did another thing. I decided to do one residency and then just changed. No one tells you along the way that it's okay to change your mind, and that a lot of people actually do. It seems that the people that are most vocal, or the people that are in front of you the most, are the ones that seem the most secure and seem to have um, figured it all out. But it's not so true. I met lots of people who had chosen one path and actually changed their paths and changed, careers completely. And that's okay too. So I think that not a lot of that is talked about. People make career changes all the time, and it's never too late. And it's never too late, to change your mind and to make something else of yourself. And I'd say that's the number one thing.
Fantastic. Now, I know the other thing that makes your practice unique is that you work with women to help women. Tell us a little bit about your business model. Who are the people who surround you in business and why?
Well, I'd say most of the people, I just happen to hire women and seem to work well with them. They seem to be compassionate, and I'm not. I just haven't found someone that is as compassionate or understanding. The patients who come to my office are usually very anxious. Even though most patients do not have cancer, everybody comes to my office thinking that they have cancer. So it's very important that my office manager and assistant be cognizant of that, and also be very sensitive to that, and deal with my patients with kid gloves. People deal with anxiety differently. Some people are tearful and they cry. Some people are chatty and they talk. Some people are angry and they yell at you. So I always tell whoever's working with me to not take it personally, that it's usually their anxiety talking. And I find that these women have had great compassion and skill with dealing with patients who may be difficult, or patients who are extremely anxious.
So, our focus with this series of interviews is on women's health. You're on the other end where you're getting all of these samples. What are the common diseases that are affecting women right now in the United States, do you think?
Well, breast cancer is the number one cause of gender-based malignancy. Lung cancer is the number one. Colorectal is actually up there as well. Um, and we're seeing more and more younger women, just talking about non-gender based, but more and more younger women who have never smoked um, get adenocarcinoma of the lung, which is something that is puzzling, because it used to be that smokers would get lung cancer, but there's now more and more research going into women who have never ever smoked, and they're younger. They're younger women who are getting cancer than older women who have traditionally smoked or older men who have smoked. Other cancers, obviously, breast cancer is, and this is October is Breast Cancer Awareness Month. Breast cancer is the number one gender cancer and I'd say number one lethal cancer in women. I mean, particularly just in women, gender cancer. And then colorectal cancer is one of those cancers that we may not be as aware as other cancers that have maybe more limelight and are much more in front and center. I think that colorectal cancer, the recommendations for colon cancer screening are now in younger and younger populations. It used to be 55. It's now starting to drop to 50. And if you have anybody that's in your family with colorectal cancer, then you need to have screening done earlier as well. And I mean, thankfully, GYN cancers, such as cervical cancer, is actually decreased compared to 40 or 50 years ago because of the advent of pap smears, of cervical pap smears. Cervical pap smears really helped lower the rate and incidence of cervical cancer by a lot. And it became a useful screening tool. And that's, I mean, cervical pap smears is part of cytopathology, is what part of my training of what I did, what I do and what I did.
So a lot of things can be prevented if women are more aware about going in for these screenings, so things are caught at an earlier stage, correct?
Yes, of course. They've changed pap smear screening to getting screenings after the age of 21 because they found that patients under the age of 21, a lot of them had HPV, low risk HPV changes, and doctors were being too aggressive in treating these lesions, low grade lesions. And this way, because most of the young patients actually, their body's immune system can actually take care of it. And so it doesn't progress to cancer. But having a pap smear once a year, or actually once every 3 years, once you have a normal pap smear for several times, is a good way to catch cervical cancer or cancer that's kind of moved up the canal. It sometimes can catch postmenopausal endometrial cancer, but it's really not a good screening for that. Another good screening tool is mammography for breast cancer, mammography, and sometimes in conjunction with ultrasound for breast cancer. And then, of course, like I said, colorectal cancer, getting a colonoscopy.
Fantastic. So now let's focus on you, the woman behind the business. You are juggling, running this amazing business. You're married, you have family. What is your work-life balance? How do you balance out the pressures that you have on work and running a household?
Well, I'm lucky because I do have support. I mean, I've always had support throughout my training. I have 3 children, 3 boys, lovely boys, and their age range is from 21 down to 11. And so I have 3 kids in all kind of stages of life. But I have a lot of support from my husband. We live in a multi-generational home with my mother. So, as she's aging, I'm having to take care of things pertaining to my mother and things that she would have taken care of previously. And I really, when I embarked on my career after residency, I really wanted to make sure that I had that life work balance. And I chose to become an entrepreneur and a businesswoman, even though I had no formal training in it and had no idea what I was doing in the beginning. I've learned a lot because I really wanted to have that balance. I wanted to be a mother and be present and be able to come home and make dinner for my kids and bake cakes and celebrate their birthdays and go to their school plays and their award ceremony and have that kind of flexibility. Whereas a traditional pathology job where you're in a laboratory or at a hospital, 40-hour a week doesn't afford that kind of flexibility. And I'm not saying it's not completely flexible, because pathology is a little bit more flexible than, let's say, other specialties such as surgery. But I made a very conscious decision to go the way of entrepreneur rather than go the way of most of my colleagues, which is the traditional trajectory of residency and then getting a job in a lab or a hospital. So I made a very distinct and specific decision in my mind that I was going to do that, and I've been lucky because my husband works as well in the medical field, and has allowed me to be able to be more flexible in my job as well.
Fantastic. What would you say is your proudest moment in terms of your business achievements?
My proudest moment? Um, I don't know, but it's still there. I guess I'm still standing. I guess like I'm here. I'm still here, and I'm still able to pay the rent, and I'm able to make some money and pay my office staff. I think that's the greatest achievement, and I'd say, I mean, as a solo practitioner, it's getting harder and harder. But I'd say just today, I work also at the county hospital at the outpatient Martin Luther King Jr. Outpatient Center in South Central Los Angeles for the underserved. And I had to call one of the ear, nose, and throat doctors because I had to tell him about malignant diagnosis. And he always says, "Hey, where's my favorite needle doctor?" But he also refers me patients privately. He has a private practice. And he said, you do great work. I mean, it's very rare. Patients don't, most, like my other friends who are clinicians, like pediatricians or OBGYNs or internists, they get presents from their patients, they get letters or notes, they get a lot of accolades. Most patients say, "Yeah, I like you, Dr. Nadelman, but I never want to see you again." So it's really nice that I do have someone, in the community who does appreciate what I do, and that I really want to bring like excellent care to everybody. Like, it doesn't matter to me. I do see a lot of like celebrities and high need patients, but I also see people from South Central LA and the needy. And I really want to give the best possible care to everybody because I think everybody deserves it. And so I'd say that's probably, part and parcel of my proud moments. I mean, professionally. My other proud moments are my children, of course,
Oh, I love that.
Proud mama, right?
Oh, wonderful. So I'll end my interview with you just giving some words of advice to somebody who is not feeling well, they're hesitant, they don't want to have a biopsy, they don't want to go and see a doctor. Why is it important for us to do these things and to do it early? Just give our viewers.
Yeah, everybody's worried about it, but you can't, like I said, cancer doesn't really wait. During the pandemic and the initial lockdown in March, they actually closed my clinic at MLK Junior Outpatient Clinic And then the endocrinologists and ENTs and the surgeons said, no, we need her, because people still come and say, Doc, I have a lump. I need to get it looked at. And even in my private practice, although things slowed down and people were not leaving their homes, every person who walked in my door had a malignant diagnosis, which was astounding. I mean, it was sad and astounding, but it just goes to show you that, you need to kind of nip it in the bud. And it's not necessarily things that show up aren't necessarily malignant. They just might be something that you need to take care of. A lot of head and neck tumors, salivary gland tumors are benign. Most of them are benign, but you need to take them out because they grow, and then it's harder to actually take them out, and they kind of spread little tentacles. And if you leave a little cell behind, then it kind of grows back, and then it's kind of a pain in the butt to have to keep going back and rebiopsying and re-excising the lesion. So it's better to have it when it's, take care of it when it's smaller than when it's larger. That's just, it's just easier on everybody. And then if it is malignant, if it's at a lower stage, obviously you have better prognoses and you have better ways of treating cancer when it's smaller and hasn't spread yet.
Fantastic. Thank you so much for this interview. And
thank you so much
to everybody who has tuned in. And people can get hold of you through your website, correct? What other social media platforms are you available?
So it's drnadelman.com is my website. And on Instagram, I am Dr. Cancer Answer. You can follow me there, as well as on Facebook, Dr. Celina Nadelman, MD. Thank you so much.
Thank you so much, Dr. Nadelman. Absolute pleasure to have met you. And thank you to everybody who tuned in from around the world. We'll be back again tomorrow with yet another fascinating guest. Have a fantastic day, morning, evening, wherever you are in the world. Bye for now. Thank you, Doctor.